This is a presentation comparing electronic health record systems by Amy Hall, Alyssa Kjeldsen, and Andrea Watson. CureMD is a cloud-based electronic health record system, a practice management system, and a patient portal. If a clinic chooses to use the CureMD EHR system, their monthly cost will be $295 per provider. If they choose to solely use the practice management system, their monthly cost will be $195 per provider. However, if they choose to use both within their practice, their bundled monthly cost will be a reduced $395 per provider. CureMD's many clinical EHR features include appointment and management scheduling, clinical reviews, patient notes, medical histories, document management, stakeholder communication, networking, workflow automation, lab management, data analytics, a patient portal, referral management, and financial reporting. These features allow a full-circle approach for providers when managing their medical practice through CureMD. OpenEMR is an internet-based electronic health record system, also including a patient portal. This EHR system is free to providers and able to be accessed through a clinic's network. OpenEMR's many features include integrated health records, practice management, patient scheduling, electronic billing management, internationalization, demographic management, document management, medication management, clinical note generation, procedure tracking, referral management, and e-prescription. While slightly more limited than CureMD, OpenEMR still provides a well-rounded approach to medical management. CureMD's software has much potential for data storage, seeing as though it is a cloud-based system. This provides a virtually unlimited capacity for storing information. CureMD is also ONC certified, utilizes an HL7 interface allowing for laboratory integration, supports multiple data formats, and is compatible with Windows 7, Windows Vista, Windows XP, OS interfaces, Windows 2000, and various Apple products. OpenEMR has a large capacity for data storage, yet is slightly more limited than CureMD due to its internet basis. If users choose to purchase additional storage, they will face a cost anywhere from $5 to $140, depending on their chosen storage upgrade. OpenEMR's data transmission is supported through both wide area networks as well as local area networks, and their software relies on transmission control and Internet Protocol for data exchange. OpenEMR is ONC certified, supports various data formats, and is supported via Windows 7, Linux, and Mac OS X. However, due to its lack of upgrading, OpenEMR is incompatible with Windows 2000, Windows XP, FreeBSD, and OpenBSD.
The architecture of CureMD. Once the application is processed and purchased, each practice will be assigned a unique, specific URL. This application may be accessed throughout its use of the web-based enterprise practice management solution. You can download it to your computer, and CureMD does have a mobile application called the Avalon that you can use through iPad and iPhones. The users can navigate through the application by logging in to their credentials and utilizing the dashboard that helps streamline all they need. When talking about eligibility, they can utilize the eligibility verification. That means no more phone calls to insurance companies to verify patient eligibility. The scheduling is easier for physicians because they can schedule right there in the office instead of you having to go to the front desk and waiting to make a schedule. The e-claims studies have indicated that practices lose 1/3 of their revenue to patient collections. The billing provides innovative functionalities for automatic charge capture, clean claim checks, electronic claim submissions, and electronic payment postings, denial management, and financial reporting to help reduce errors and maximize revenue. The dashboard also reminds physicians of certain tasks that they may need to complete or collect so they can communicate this effectively. The rules engine automatically makes sure you're in compliance with the HIPAA and meaningful use for those Medicaid and Medicare patients that clinic sees. The task also helps make sure that statements are being processed. Everyone in the office is up to date with what they need to do. The architecture of the Open EMR is an open source. You can access it through some of the web bases such as Windows and Mac OS X. The Open EMR is designed to help physicians be able to collaborate with third parties and store information. Once you have the URL is reached, the login page will be available to users. Initially, each user will have to log in using a general username such as admin and a general password such as pass in order to enter the application. However, once the user is able to enter the system, the username and password may be changed to accommodate each individual associate. I would highly recommend doing this. The Open EMR has a dashboard with a variety of options to choose from. The calendar keeps track of patients and scheduling openings for the clinic. Messages option helps utilize patients to be able to send emails to the doctors and for doctors to reply to them if they can't make it to the clinic instead of sitting on the phone. It's user-friendly and able to help keep things going. They also order labs, send information to other physicians, and collect claims off on this application. The users navigate it through the internet. Unfortunately, this application does not have a mobile device application where physicians could be on the go. Privacy and security of any application is always a concern. You don't want your information to be leaked out. You don't want someone to accidentally send information to the wrong person. Keeping patients' files online is very important, and you have to follow HIPAA standards. The CareMD HIPAA standards need to be specific and well thought out during an implementation of an electronic health record. Every company will have to set standards that need to be met by their physicians and workers who have access. The employees need to have proper training on the EHR and begin when they have access to it. This means making sure they know where to store information, know how to send the information, and know how to deliver the information to physicians and other third parties. The smart cloud technology that the CareMD has is used to deliver information into a health information exchange through the system and be connected through the modules it has available. With their low monthly subscription, it includes hosting, support, upgrades, maintenance, security, and business continuity services that will help keep all the patient's information safe and secure. This is one of the standards that CareMD has to make sure that you are following the HIPAA standards. The cloud-based system reduces expenses in software and hardware updates and its administration. So this helps make sure that you are not spending more money that you need to be when collecting claims, making sure that it's stored in a secure place. The client-hosted cloud is good for large practices with dedicated IT staff that can help you keep their own server with CareMD installed for local and remote access. The host, you can store your own data with greater control and flexibility. You have up to like 10 gigabytes, or you could buy more depending on how big or how small your clinic is. The buying in-house internet software is good because this makes sure that you are buying the CareMD's internet in-house, so make sure that when you're logging in, you're not possibly getting a virus, and it has all these updates and everything to make sure you're on track. The employee's business continuous systems that prevent data loss while keeping your information secure, private, and accessible. Has an access authorization, so that means employees have a specific login. You have a role-based access control, a release of information, activity monitoring, so you have someone always watching what is going on there. So if something accidentally gets leaked, they can fix it right away, and an audit trail. Privacy and security of the OpenMR is a little different. Since this is an open source and you can get onto the computer and pretty much anybody has access to it, it is very, very clear that you need to make sure you have a specific log in for information that you are storing on there so no one else could get access to it. The EHR system being used should only be used by the clinic's specific server, only inside the clinic. This will prevent protected information from being taken outside the clinic where data breaches may occur. It is a secure open EMR since it is widely used, but it is more vulnerable than if you have a QRMD that you have to buy and have all this access to audit trails, an IT person constantly watching, someone monitoring what is going on. To securely transfer patient information to the healthcare providers, the Open EMR uses XML export, which allows you to communicate with proxy MED and ZIR MED for electronic claims. For the Open EMR, there are several steps you have to take to make sure you're following HIPAA standards. After the installation and upgrade, you need to remove multiple scripts that are strongly recommended moving. You have to make sure you're reading through everything when you first go into OpenEMR. Also, you need to go to the access settings to make sure that you secure uploaded files with the whitelist setting and make sure it's on. It is not on when you first download the OpenEMR. You have to go to the settings and make sure everything is on. You need to enable the encryption of items stored on the drive as well. If not using the portal and want to allow users to access over the internet, then you should consider client-sided certificates to only allow users access to the site. This is an additional charge, but it will make sure that your users and everyone's information is being protected. The evidence-based medicine support for the QRMD has great features to make sure that you are meeting the patient's needs and are making them satisfied. The QRMD includes a feature where providers are able to search and review medical literature to support and aid in diagnosis. This will help physicians be able to know what other literature, what other advances, what other technology and medications are out there so they can help make sure that the patients are getting exactly what they need. With the aid of these features, patients are able to communicate their informed opinion to the physicians based upon what they have been told and educated on. This enables the group as a whole to decide what is truly in the best interest of the patient as far as the treatment goes. They can connect to thousands of pharmacies that give them educated information and alerts when patients cannot take the medication. Also, the patients can look up a variety of articles, information on the disease or diagnosis that they have. They also could look up the side effects of the medication that, possibly they forgot when the doctor went there. They could go through the patient portal and they can make sure that they're up to date. Say they're not feeling good, they could go and look and see maybe if that's a side effect of anything. The evidence-based medicine for the QRMD is wonderful. There's templates. You can send and receive data to physicians, pharmacies, any third party that needs to be. It has alerts that automatically alerts the physicians of different things. You could have clinical summaries, so this could be from all the doctors. They could bring in notes from other doctors and they could upload it to the QRMD so they have all the updates from maybe a kidney doctor, if they're seeing a blood specialist, so that everyone is on the same page with different treatments that everyone is doing, so you're not affecting one thing. You have education material where you could go in and look up maybe healthy food, look up things to help you sleep better at night. The evidence-based support for QRMD is wonderful. Evidence-based medicine support for Open EMR is not as great as the QRMD. You have no really internal database where you could go in and kind of get the information that you're needing. Yes, it has a patient portal that helps the patients go look at their past history, look at lab reports, have the access to their data, which is wonderful and what a lot of people are looking for nowadays, so they could be connected with their health, decisions, and making sure that they are on board. This is great. You can also connect with third parties, which is a great other part of the evidence-based medicine. And you can send notifications to the patients and the doctors. They have access to seeing alerts. They have access to other notes that possibly are being inputted into this. It is wonderful, and it has some things that are great for the evidence-based medicine that supports open EMR, but also has a lot of drawbacks to it also. QRMD addresses many of the IOM quality and meaningful use throughout its application. We chose 3 different ones that we think that QRMD successfully promotes throughout their application for physicians and patients. Patient-centered, efficiency, and effectiveness. For instance, efficiency may be better defined as the constant seeking to reduce the waste of supplies, such as the cost. The QRMD provides rich clinical content and custom forms built for multi-specialty practices, such as orthopedics and any other specialty. This includes The feature will allow the physicians to save time overall, preventing them from having to find correct templates for the work, as there is custom ones on there for them to choose from that is specific to their specialty. Patient-centered environment is characterized by providing respectful and responsive care that ensures that patient values guide clinical decisions. The QRMD is designed in a fashion that allows connection between all stakeholders and affiliated businesses. This is especially when regarding access to medical records. With this ability, the clinic is able to make evidence-based decisions that will provide the most accurate data possible, helping to give the patient the best outlook for their care. Effectiveness will be improved upon with this use of QRMD. The integrated billing and practice management features, along with robust analytics and reporting, will repair revenue leakage, save time, and empower decision-making. QRMD clinics have the ability to utilize structured data for clinical trials, research, and reporting. This is helpful for the patients because they could feel like that they're involved in their care and that they're getting the best care that is possible. Although the Open EMR has similar aspects as the QRMD, they promote different things throughout their application when providing IOM quality and meaningful use. The Open EMR system allows patients to have unlimited access to the records, the reports, labs, and notes from all physicians involved in their care. The physicians gain the ability to navigate complex patient algorithms by using clinical decisions and regulations that provide the highest quality of care possible. This is patient-centered because the patients are involved and they're knowing they get the right care. Efficiency, when talking about Open EMR, allows the clinic to ensure that the billing is completed and carried out correctly. This also includes that it maintains its standards set by lawmakers in the healthcare and keeps insurance tracking fluid, constantly updating billing advisors and the patients. The effectiveness of the Open EMR would be accomplished when using this system has an automated calculation feature regarding meaningful use. This feature includes the system sending clinic-wide reminders for various contents, allowing for the clinical quality measure calculations, which are then relayed to the physicians. This also can relate back to the patient centers, knowing that the patients are getting the correct diagnosis and they're following right protocols.
QRMD was designed to run on any tablet or cell phone. It runs with Excel, Word, and other Microsoft Windows compatible applications. QRMD created an application called Avalon. Avalon is the electronic health record for iPad and iPhone. It was designed for users' convenience. With this application, it allows users to log into the QRMD database and access the patient portal, which allows patients to have access to their medical records. Its architecture was also built for doctors who need to move throughout their day without being restricted to an office or room. With Avalon, they have the ability to chart on their iPad or iPhone while at the same time engaging with their patients. Avalon has a fully featured platform that supports any practice. Avalon is synchronized with QRMD's electronic health record system, which allows you to run your practice on the go and allows you to document images, schedule patients, verify eligibility, review clinical records, create demographics, create new patient records, e-prescribe, and dictate through Siri. When researching OpenEMR, which is our free electronic healthcare record system, there were no mobile versions found for this system. It was found that OpenEMR could be utilized mainly via internet access on a desktop computer. It can be accessed by using the Safari and Google Chrome browsers. We were also not able to find any information that OpenEMR supported any downloadable applications or that it was supported by any mobile devices. When looking at long-term investments between QRMD and OpenEMR, QRMD would be the more expensive option between the two, considering that OpenEMR is a free download. With QRMD, there's a monthly subscription fee that's charged on a per provider basis. The subscription fee covers software, hosting, maintenance, backup, and support. There's a number of variables that determine the cost, which includes one-time setup fee and a monthly subscription cost. With QRMD, you have several options to choose from. There's just the practice management, which is $195 a month per provider. The electronic health records, which is $295 a month per provider. And the all-in-one, which includes practice management and the electronic health records, which is $395 a month. This feature includes the practice management and EHR features, plus document management, order sets, referral management, PQRS reporting, iPad app, support via phone, email, and tickets, and it also has educational webinars or videos. Throughout our weeks of research, QRMD has remained to stay on top as the stronger system. It is known as one of the leading providers of health information management solutions with specialty-focused electronic health records. It's highly adaptable and user-friendly. QRMD also has advanced security that will help to prevent data loss and maintain patient information in a secure environment for our 3,000 patients. It also has the capability of supporting the possibility of a growing company. QRMD has the ability to eliminate errors in regards to reimbursement for billing insurance companies, and it also has templates that could be focused specifically for that clinic's field of work, which leads to improving the quality of care of our patients.